Hello, my friends. I'm Dr. Anna Schneider, and if you're here, I'm guessing you've felt that nagging, soul-crushing ache in your lower back that just won't quit. Maybe it's been days, weeks, or even years of feeling like your body's betraying you. Well, today, I'm here to tell you something life-changing. You have the power to take control of that pain, starting right now. Yes, you heard me. As a doctor who's spent over 2 decades helping people just like you reclaim their bodies, I've seen it all: tight muscles, old injuries, and even those sneaky lifestyle habits we don't realize are sabotaging us. And here's the truth: your back doesn't have to rule your life anymore. Today, we're diving into the most common culprits behind low back pain and, more importantly, what you can do about it instantly. We'll talk science, because I'm a nerd for how our bodies work, but I'll break it down so it's crystal clear, like chatting with a friend over coffee. And here's my promise: by the end of this video, you'll walk away with practical tools, a spark of hope, and a fire in your belly to say, "I've got this." So, grab a notebook, get comfy, but not too comfy, because we're about to move, and let's kick that back pain to the curb together. Ready? Let's do this. Alright, let's start with the number one villain I see in my practice every single day: sitting. I know, it sounds innocent, right? You're just chilling at your desk, driving to work, or binge watching your favorite show. But here's the kicker: the average person in the US sits for 10 to 15 hours a day. That's insane. And it's quietly wreaking havoc on your lower back. Let me explain why this happens, and don't worry, I'll keep it simple. When you sit, your body goes into what I call a flexed state. Picture this: your hips are bent, your knees are up, and your spine is curved forward. Over time, this shortens 2 key muscle groups: your quadriceps, those big muscles in the front of your thighs, and your psoas, a deep hip flexor that connects your spine to your legs. These muscles are like the puppet masters of your pelvis. When they get tight from hours of sitting, they pull your pelvis forward, tilting it out of whack. And guess who has to pick up the slack? Your lower back muscles. They end up in a constant state of tension, screaming for relief. But it gets worse. While your flexors are tightening up, your gluteus maximus, your butt muscles, get weak and lazy. I've seen it time and again: patients come in with flat, atrophied glutes because they're not being used. Your glutes are supposed to be the powerhouse that balances out those tight flexors, but when they're out of the game, your lower back takes the hit. It's like asking a single teammate to carry the whole load. No wonder it's exhausted. Now, here's where the magic happens. You don't need fancy equipment or a gym membership to fix this, you just need to stretch. My go-to recommendation? The standing quadriceps stretch. Let me walk you through it, and I want you to try it with me right now if you can. Grab a chair for balance, stand tall, and take your right hand to hold your right ankle behind you. Pull your foot towards your glutes, keeping your knees close together. Feel that stretch in the front of your thigh? That's your quadriceps waking up. Hold it for 10 seconds, count with me: 1, 2, 3, all the way to 10. Now switch sides. Do this 5 times on each leg, and pay attention: which side feels tighter? That's a clue about where your body's been compensating. I've had patients tell me their back pain melts away after just 1 round of this stretch. Why? Because it's like hitting the reset button on all that tightness. It gives your lower back some breathing room, letting those overworked muscles relax. And here's the best part: you're not just fixing the symptom, you're addressing the root cause. How empowering is that? But let's be real, stretching alone won't undo 15 hours of sitting. You've got to move, my friend. I tell my patients to aim for at least 1 hour a day of walking. Not on a treadmill staring at a wall. Get outside. Walk on grass, sand, or dirt if you can. Barefoot is even better. Why? The uneven surfaces wake up the tiny muscles in your feet, which send signals up your spine to stabilize your back. It's like a free massage for your nervous system. I remember one patient, Sarah, who swore her back pain vanished after a week of barefoot walks in her backyard. She said, "Dr. Anna, I feel like a kid again." That's the kind of joy I want for you. So, here's my challenge. How many of you are sitting right now? Stand up, yes, right this second, and do that quad stretch with me. Tell me in the comments how it feels. Does one side feel tighter than the other? I'm dying to hear your experience. Now, let's talk about something that might surprise you: vitamin D. You might think of it as the sunshine vitamin for your bones, but it's so much more than that. In my years as a doctor, I've seen countless patients with low back pain who had no idea their vitamin D levels were tanking. And when we fixed that, boom, pain gone, sometimes in as little as 30 minutes. Let's break this down. Vitamin D isn't just about calcium and bones, it's a key player in muscle function and inflammation control. When your levels are low, your muscles can get twitchy and weak, and your nerves get hypersensitive. For your lower back, that's a recipe for disaster. The muscles that support your spine, like your erector spinae and multifidus, start to struggle, and even small movements can feel like a knife in your back. Studies back this up. People with chronic low back pain often have vitamin D deficiencies. It's not the only cause, but it's a big one. So, how much do you need? I recommend starting with 30,000 IU of vitamin D3, just for a short boost if your back's screaming. That's a high dose, so check with your doctor first, especially if you're on meds or have kidney issues. But for most people, it's safe and works fast. Pair it with a little fat, like a spoonful of peanut butter, because vitamin D is fat-soluble. Within an hour, you might feel your back sigh in relief. I had a patient, Mark, who called me after his first dose and said, "Dr. Anna, it's like someone turned off the pain switch." That's the power of giving your body what it's been begging for. Long-term, aim for 5,000 to 10,000 IU daily, depending on your sun exposure and skin tone. And here's a tip: get outside. Sunlight on your skin is the best way to top up those levels naturally. Even 15 minutes a day can make a difference. I love taking my coffee breaks outside, it's my little rebellion against the indoor life. Quick question for you: when's the last time you had your vitamin D checked? Drop it in the comments, I'm curious. And if you try this trick, let me know how fast you feel the difference. Your body deserves this boost. Okay, let's get into something a little sneakier: asymmetry. Your body's like a finely tuned machine, and when one part's off, the whole system feels it. Maybe you've got tighter quads on one side, or your shoulders are uneven from carrying a bag all day. Or, here's a big one, maybe you've got an old injury that's been quietly throwing everything out of alignment. Let me tell you a story. Back in my college days, I sprained my ankle playing soccer. I thought I'd healed, but years later, I noticed my right hip ached after long shifts. Turns out, I'd been limping slightly ever since, tilting my pelvis and stressing my lower back. It's wild how a little twist from decades ago can haunt you. I see this all the time: old ankle sprains, knee injuries, even a stubbed toe can set off a chain reaction. So, how does this cause back pain? When one side of your body's tighter or weaker, your spine compensates. Maybe you lean a bit when you walk, or your hips twist unevenly. Over time, that wears down your joints and tires out your muscles. Sports like golf or tennis, where you're always swinging one way, can make it worse. But don't worry, we can fix this. First, check your flexibility. Stand up and try touching your toes. Can you go all the way down, or does one side feel stuck? Now lean back gently. Any stiffness? Twist side to side. Where's the resistance? These little tests show you where your body's out of balance. Then, stretch the tight spots. If your left quad's tighter, do extra reps on that side. If your neck's stiff, yes, even that can pull on your lower back, roll it out gently. The goal? Symmetry. A balanced body is a pain-free body. For old injuries, those quad stretches we talked about are gold. But if it's a disc issue, like a bulge or herniation, try this: lie on your back, press 3 inches below your belly button with both hands, and hold for a minute. You're relaxing the front muscles that tug on your spine. I've seen patients pop up from this saying, "Dr. Anna, it's gone." It's simple, but it works. What's your story? Got an old injury you think might be sneaking up on you? Share it below, I'd love to help you brainstorm. Now, let's zoom out. Sometimes, low back pain isn't just about muscles, it's your body waving a red flag. Take kidney stones, for instance. They can send sharp pain to your upper lower back, usually on one side. I've had patients come in thinking it's a pulled muscle, only to find a stone's the culprit. The fix? Hydration. Aim for 2.5 liters of water a day, about 10 cups. It's like flushing out the troublemakers before they settle in. If you're prone to stones, this is your new best friend. Then there's the prostate, guys, this one's for you. An enlarged prostate, often from too much dairy, can refer pain to your lower back. Cut the cheese, literally, for a week and see if it helps. I've seen men light up when they realize it's that simple. And ladies, if your pain flares with your cycle or you've got fibroids, that can hit your back too. Calcium lactate, about 500 milligrams, can ease menstrual cramps, and for fibroids, we'd dig deeper into diet and hormones. Sea kelp's great for ovary-related pain too, it balances estrogen naturally. These aren't the usual suspects, but they're worth checking. Where's your pain sitting? Upper back, lower, one side? Tell me in the comments, it might spark a light bulb moment. Alright, my warriors, we've covered a lot: sitting, stretching, vitamin D, old injuries, and those sneaky organ issues. But here's the heart of it, you are the hero of this story. Your back pain doesn't define you, it's just a signal, and you've got the tools to answer it. Start small, stretch those quads today, sip that water, step into the sun. Every move you make is a vote for your strength, your freedom, your life. I'm so proud of you for being here. You're not just watching, you're fighting for yourself, and that takes guts. So, let's keep this going. Drop a comment below, where are you watching from, your city or country? How did that stretch feel? Any pain stories you want to share? I read every single one, and I'm here for you. Hit that like button if this helped, and subscribe, I've got more tricks up my sleeve to keep you thriving. This is Dr. Anna Schneider, your back pain busting buddy, signing off. You've got this, now go own it.